Welcome to this explainer. I am so thrilled to have you here today because we're jumping right into a truly fascinating pharmacological mystery. We're going to unpack a word you probably think you know, but as we peel back the layers, you're going to see it's actually hiding a double identity. Our focus today is the term cotrimazole. Get ready because we're diving deep into the science, the exact spelling, and the cellular mechanisms of the very real medications hiding behind this common mix-up.
Take a really close look at how this word is spelled. Cotrimazole. C-O-T-R-I-M-A-Z-O-L-E. Have you ever seen this exact spelling printed on a tube of cream or a pill bottle in your pharmacy? It sounds super familiar, right? Like something you'd just pick up over the counter for an everyday infection? But I'm going to drop a major hint for you right out of the gate. This specific word, spelled exactly like this, is actually a pharmaceutical ghost. It literally doesn't formally exist.
So here is the big reveal. The word cotrimazole is actually just a really common accidental mashup of two entirely different, very real medications. You've got clotrimazole, which has an L, and you've got cotrimoxazole, which has an X and an O. One is a topical antifungal, and the other is a systemic antibacterial. Mixing these two up in a real-life clinical setting could literally mean the difference between rubbing a harmless cream on a rash or taking a heavy-duty oral antibiotic with serious side effects. So let's put both of these under the microscope.
Section 1. Meet clotrimazole, the antifungal champion.
If you've ever dealt with a common superficial fungal infection, this drug is an absolute heavy hitter. If we follow the antifungal family tree right down the imidazole branch, you'll find clotrimazole sitting right at the top of the topical agents. It is firmly rooted in the imidazole family, and what that means is its entire chemical structure is perfectly engineered to be applied locally, right onto the site of an infection.
To define it plainly, clotrimazole is the most commonly used topical imidazole antifungal drug out there. Its absolute primary targets are dermatophytes, which are the annoying fungi that cause things like ringworm, and candida, which is the yeast responsible for a whole host of common infections. It is the go-to weapon for surface invaders.
Section 2. Fortress breach, how azoles destroy fungi.
But how does a simple cream actually stop a living fungus in its tracks? Well, fungal cells have a protective outer membrane, sort of like a fortress wall. Clotrimazole completely sabotages the fungus's ability to build that wall through a really precise three-step mechanism. First up, it penetrates the fungus and specifically inhibits a vital fungal cytochrome P450 enzyme, one called lanosterol 14-demethylase. Second, by knocking out that enzyme, it totally impairs the synthesis of something called ergosterol. You can think of ergosterol as the essential structural bricks of that fungal cell membrane. Third, without those bricks, the fungus experiences a massive cascade of membrane abnormalities. It loses its toughness, it becomes osmotically susceptible, and essentially the fortress just collapses from the inside out.
Section 3. Clinical success, curing fungal invaders safely. So now that we understand the biology, how does it actually fare against everyday ailments? Well, the data shows an amazing 60 to 100% success rate. That is a massive clinical cure rate. When you apply clotrimazole properly, which is generally a twice-daily schedule for about 2 to 4 weeks, it clears up tinea infections, or ringworm, at an astonishingly high rate. It's just incredibly reliable.
Now, it's not a magic bullet for absolutely everything, but it totally dominates superficial infections. We're talking highly effective for athlete's foot, otomycosis, which is a fungal infection of the ear, as well as vaginal candidiasis and oral thrush. In fact, for oral thrush, it can even be taken as a 10 milligram troche that just dissolves in your mouth. However, it does have poor efficacy for dense, really deep infections like tinea capitis on the scalp or tinea unguium in the nails. The topical cream just can't physically penetrate deep enough into those hard keratin structures.
And what about safety? The profile here is just fantastic. Because clotrimazole is used topically and isn't absorbed systemically into your bloodstream, there is zero systemic toxicity. The absolute worst side effect most patients might occasionally experience is just a little bit of local stinging or irritation right where the cream is applied. It is exceptionally well tolerated.
Section 4. Cotrimoxazole, the antibacterial cousin.
Now let's pivot to the other side of our naming mashup, the one with the X and the O. Cotrimoxazole is sharply different. This is a systemic antibacterial. It's taken internally, usually orally, and it circulates through your entire system. The source data specifically highlights its frequent use for the long-term suppressive treatment of lower urinary tract infections, or UTIs, and it's often prescribed as a 480 milligram daily dose. This is powerful internal medicine, which is fundamentally different from a topical surface cream.
Because it is systemic, the adverse risks are significantly higher. We are definitely not just talking about a little local stinging anymore. We're talking about systemic nausea and stomatitis. It can cause a folate deficiency leading to megaloblastic anemia. It is strictly contraindicated during pregnancy due to theoretical teratogenic risks, and it carries a real risk of neonatal hemolysis if it's given near term. Plus, it carries a serious risk of bone marrow toxicity, and the data specifically notes this risk is particularly high in elderly populations and AIDS patients. So this is a complex, heavy-duty drug that absolutely requires careful medical supervision.
Section 5. Summary of key differences. Clearing the confusion.
Let's bring this all home and look at the distinct paths of these two sound-alike drugs side by side. Cotrimazole is your topical antifungal. It's for surface yeasts and ringworm, and it's incredibly safe, even during pregnancy, because it just stays on the skin. Cotrimazole, on the other hand, is your systemic antibacterial for internal bacterial infections like UTIs. It carries a much higher toxicity risk, including bone marrow issues, and is strictly contraindicated in pregnancy. They might sound identical if you mash them up in your head, but biologically and medically, they are worlds apart.
So I want to leave you with this final practical thought. It is time to check your own medicine cabinet. Seriously, go take a look at those tubes and bottles you've had sitting around. Which C drug do you actually have in there? Do you have the antifungal champion clotrimazole or the systemic antibacterial cotrimoxazole? Knowing exactly what you are putting on or inside your body is the absolute foundation of good health. Thanks so much for joining me on this explainer, and keep asking those great questions.